Hello student, today's topic to be discussed is aquatic activity program for disables, importance of aquatics for disables and nature of aquatic activity program on different type of disabilities. Aquatic activities for children with disabilities can foster physical fitness and motor skill development within a physical education program and during the recreational pursuits. It is legal right to request swimming as a part of IEP, Individualized Education Program, because aquatic is listed as a component of physical education under the Individuals with Disability Education Act, IDEA. Aquatic instruction for students with disabilities is neither a luxury nor a therapeutic. Water is a magical medium that helps people with disabilities to be able to walk, jump, and play in a safe way. This buoyancy makes a person 90% lighter in water, which makes some individuals who would not be able to walk on land to take steps in water. Adapted Aquatic modified the aquatic teaching environment, skills, facilities, equipments, and instructional strategies for people for disabilities. Aquatic activities program can include different type of aquatic activities, including instructional and competitive swimming, small craft boating, water aerobics, and skin diving or scuba diving, according to AFER Alps 1996. Individualized instructional planning begins with defining which skill a participant needs to learn and assess the present level of performance in those skills. Before performing the assessment, an instructor should determine the skills to be assessed. To help prioritize the skills, questions such as these should be asked of the participant or caregiver. Number 1. What is the participant's interest in learning? Number 2. What are the important safety skills for the participants to acquire? And next, number 3. Where will the participant use the skill outside the class? And number 4. What are the ages of the pair performing in aquatics? Number 5. What equipment does the family have? And last, number 6. What are the medical, therapeutic, educational, and recreational needs of the participant? After looking at all the possible skills that are important for a participant, the instructor look at the list of the determine if there are any repeat skills. Skills common to many of the questions such listed should become the priorities to assess and then be taught if they are lacking. Assessment items that determine the present level of performance in these skills should be developed. Aquatic activity can enhance physical fitness and motor skills development within a physical education program. Physical educators, school administrator, parent, related personnel, and special education teacher must be educated about the importance of aquatic activities. The physical and psychological level of aquatics for students with disabilities are more pronounced and significant than for students without disabilities. Because of the buoyancy afforded by water, Many people whose disabilities impair mobility on land can function independently in an aquatic environment without the assistance of braces, crutches, walker, or wheelchairs. Although adapted aquatic does not focus on therapeutic water exercise, warm water facilities, muscle relaxation, joint range motion improve muscle strength and endurance. Corey 1996. Swimming strengthens the muscles that enhance the postural stability necessary for locomotors and object control skills. Water support the body, enabling a person to possibly walk for the first time, thus increasing strength for the walking on land. Adapted aquatic also enhance breath control and cardiovascular fitness. Blowing bubbles, holding one breath, and inhalation and exhalation during rhythmic breathing of swimming strokes improve respiratory function and oral motor control, aiding in speech development, according to Martin 1983. Importance is not limited to the physical realm. Water activities that are carefully planned and implemented to meet individual needs provide an environment that contribute to the psychological and cognitive development. As a student with a physical disability learn to move through the water without assistance, self-esteem and self-awareness improve. Moreover, the freedom of movement made possible by water boosts morale and provides an incentive to maximize potential in other aspects of rehabilitation. The motivational and therapeutic properties of water provide a stimulating learning environment. Some instructors even reinforce academic learning, successfully integrating cognitive concepts during water game and activities centered on math, spelling, reading, and other concepts. Participants might count laps, drive for summer's plastic leather, or read their workout from a whiteboard. These type of activities also help participants improve judgment and orientation to surrounding environment. Next point to be discussed is nature of aquatic activities for disabled. Each person is unique and individualization is the key to safe, effective and relevant programming. Thus, it should never be assumed that all characteristics associated with a disability are endemic to each person with their diagnosis. Generalizations merely present a wide scope of information that might pertain to swimmers with any particular disability. Each swimmer should be taught sufficient safety and swimming skills to become as safe and comfortable as possible during aquatic activities. Choice and presentation of skills should be tailored to meet the needs of each individual, according to Lepore, Gale, and Stephen 2007. Before instruction begins, the teachers must gather information from written, oral, and observational sources. In addition to reading previous records and interviewing the swimmers and significant others, an aquatic assessment must be conducted to determine the present level of functioning. General instructional suggestions include writing long-term goals and short-term performance objectives, task analyzing aquatic skills, determining proper lift and transfer methods, establishing communication signals, and developing holding and positioning techniques to facilitate instruction. Knowledge of typical growth and developmental pattern is helpful in understanding the difference between movements that are developmentally inappropriate and movements that have just not developed yet. For example, doing a bicycle kick is a developmentally appropriate sequence for most children who are learning to swim. But after more experience and decreased fear, this type of kick is inappropriate during freestyle movements. Teaching basic safety skills first, such as mouth closure, rolling over from front to back, changing directions, recovery from falling into the pool, vertical recovery from front and back positions, and holding onto the pool wall help to alleviate fear of more difficult skills. A balanced body position in water is an important prerequisite for skills. The instructor must experiment with horizontal and vertical rotation and appropriate placement of arms, legs, and head to teach the development of proper buoyancy, balance, and water comfort in relation to the student's unique physical characteristics. One method of teaching balance and body position in adapted aquatics is the whole week method, that is Stannett and Limbeck 2001. Finally, presenting swimming cues in a concise manner and connected to something that the student already is familiar with strengthen learning. Because swimming takes place in a unique setting, swimmers with disabilities need cues that refer to situations or movement they already know or know how to do. An example is using the phrase, "Move your hand as if you are opening and closing curtains," to depict the movement of the hands while treading water or schooling. Before adapting skills to meet a student's needs, the instructor must first look at why the skill is needed and how and where the skills will be used. Some swimmers might want to pass the competencies for higher levels. Some might want to improve cardiorespiratory functioning, and yet others might want to enter a swim meet. These differing purposes for performing the front crawl freestyle might cause an instructor to take a different approach to adapting strokes. And other aquatic skills. Important consideration in adapting strokes include the following points. Number one, what are the physical constraints for the disability? Next point, what is the most efficient way to propel through water given the constraints? Number three, what movement will cause or diminish the pain or injury? Fourth point, what adaptation can be used to make the stroke or skill as much like not adapted version as possible? Next, number 5 points, what equipment is available to facilitate the skills? Next 6 point, why does the swimmer want to learn this skill? Competition purpose or relaxative purpose? In this, the instructor might need to, number 1, adjust the swimmer's body position by adding flotation or light weight. Next point, change the propulsive action of the arm or legs. Next point, adapt the breathing pattern. adjusting the swimmer's body position is typical for people who have disabilities such as cerebral palsy, CP, stroke, traumatic brain injury, spinal bifida, obesity, limb loss, muscular dystrophy, post-polio syndrome, or traumatic spinal cord injury. Because of the variation from the norms in regard to muscle mass and body fat in the many people with physical disabilities, the center of gravity and center of buoyancy might be atypical. It is important to find an efficient body position. Indication for aquatic activities is also very important. Let us discuss this one. The contraindication for aquatic activities are sensory disorder, limited range of motion, weaknesses, poor motor coordination, pain, spasticity, perceptual or spatial problem, balance deficits, respiratory problems, circulatory problems, depression or poor self-esteem, cardiac disease, joint replacement, orthopedic injuries or trauma, obesity, osteoporosis, rheumatology, that is arthritis and fibromyalgia. Orientation to water. Orientation to water focus on readiness of the learner and other psychological and physiological factors. First, psychologically, each person is unique, learn at an individual rate depending on several psychological factors. Individuals with disabilities might have psychological characteristics that hinder acquisition of aquatic skills. Some psychological factors such as anxiety and cognitive readiness should be examined before developing instructional strategies. Physiological factors are those in which anatomical and physiological variations in an individual's body affect how and what he or she learns. This includes how disability and medication affect its body system. A swimmer might not be neurologically ready to perform a skill because of brain damage, lack of central nervous system maturity, or a developmental delay. When the instructor understands the effect of a disability or learning and provides developmentally appropriate skills, progressions, learning is increased according to Langerdorfer and Breuer 1995. Most anxiety during swimming instruction stems from fear and discomfort and inhibit mental adjustment to the aquatic environment. Factors that might cause anxiousness in a swimmer include fear of drowning, past frightening water experience, submerging unexpectedly, and choking on water, fear reinforced by warning, for example, don't go near the water or you will drown. Capsizing in a boat, being knocked down by a wave, or feeling of insecurity caused by poor physical ability or unfamiliar surroundings, according to Lepore, Gale, and Steven 1998. Fear stimulates physiological responses such as heightened muscle tone, increased involuntary muscle movement, and inability to float. Fear and insecurity prevent success in swimming. Helping participants get a pass of fear and anxiety to practice aquatic skills that will make them safer in the water is an initial step in teaching swimming. When participants are free of fear, they are free to learn. The following tips taken from YMCA of USA Parent, Child and Preschool Aquatic Program Manual 1999A will promote comfort and reduce fear. These suggestions can be used for all ages of participants. Allow more reluctant participant extra time for water acclimation activities. Number 2, use a passion without pampering. Number 3, gently guide, don't force. Number 4, explain everything in a calm, quiet, matters of fact voice. Number 5, teach in shallow water, for example, on pool step, water tables or water docks, or on a gradually sloping ramp. Number 6, emphasizing non-competitive activities. Number 7, provide a marks or goggles if water in the eyes is an issue. Number 8, provide redirection of crying of anxious behaviors by using a colorful or pieces of equipment or discussion of the swimmer's favorite food. Number 9, use the swimmer's name frequently. Smile and praise small step in the progression of water adjustment. Number 10, assess an individual's readiness for swim lessons. Use an assessment such as the Aquatic Readiness Assessment Tools by Langertoffer and Bruya 1995. Areas to assess with these tools are water entry, breath control, buoyancy, and body position, arm actions, leg actions, and combined movements. Fear is diminished when the aquatic instructor and swimmers easily communicate. In addition to communication skills, a thorough understanding of proper participant positioning, guiding, and supporting is essential. Proper methods of transferring, touching, and supporting participants in the locker room, on the pool deck, and in the pools will also develop relationship based on trust. Knowing how to use and work all the adopted equipment, wheelchairs, and flotation devices provide an atmosphere of efficiency and safety that makes everyone feel comfortable. Likewise, holding someone with firm and balanced grip as close as safety and comfort allows, communicates, care, and establish trust and rapport, according to Lepore, Gale, and Steven 1998. In addition, an environment in which the instructor exhibits a consistent personality provides discipline methods that are flexible but consistent, uses caring verbal assurance, and provide balance and control. Physical handling promotes trust, security, and mental adjustment. Aquatic activities can enhance physical fitness and motor skills for disabilities. It improves muscle strength and endurance. Swimming enhances the postural stability necessary for locomotors and object control skills. Water support the body, enabling a person to possibly walk for the first time. Adaptive aquatic also enhance breath control and cardiovascular fitness. The motivational and the therapeutic properties of water provide a stimulating learning environment. Participants improve judgment and orientation to the surrounding environment. Due to buoyancy, body movement in water is easier because body weight in water is 90% lighter than normal. So, aquatic activities is the best modality for the disabled. Like this, let us conclude here. Thank you very much.